England's healthcare service workers, receiving national praise for staying in the job through the grueling days of the pandemic to save lives. An increasing number of them, doctors, nurses and midwives, have either quit the service or are actively considering to do so.
Profits have risen by 35% in the UK since the pandemic. More money to the rich, but not to those that are sick or for people that care for them.
The most recent culprit, poor pay. Rejecting a 4% pay increase in the face of soaring inflation, they're set to vote for industrial action.
Even with all those budgeting, we are still struggling. And so what would help in the NHS really was to increase our salary like everybody else is getting bonuses. We are not. Why? Why is this? And if you're not going to increase our salary, at least do something about transportation or even the parking. We can't be paying for things like this. It's ridiculous.
There are other reasons, too, for the exodus. A recent survey by union-led With NHS Staff campaign found stress, burnout, a feeling of abandonment after the pandemic. Some are having to use food banks or sleep inside hospitals. And it doesn't stop there.
There were other abuses of staff which made themselves clear, which also manifested, and actually a large part of the nursing workforce who want to learn also cite discrimination. And there's a large amount of bullying, harassment, intimidation, discrimination that goes hand in hand with not every environment within the NHS, but within certain environments.
More people leaving the NHS means more work to be done by those who stay, while they wait for the tens of thousands of vacancies across the country to be filled. A negative spiral hard to overcome in addition to the cost of living crisis. And then there's the years of underfunding and a wholesale drive to privatization, regardless of which party is in power.
The plan to privatize the NHS is not piecemeal, it's wholesale. I'm afraid Labour and Tory are like this. There isn't a fundamental difference in their attitude. We're already facing a winter bed crisis now. It's August, okay? And it's only going to get worse through the winter. So there is an under-provision in order to force people who can't get adequate care from the NHS into the private sector.
Created after World War II by a Labour government, the NHS is a publicly funded healthcare system, free at the point of need. Decades later, though, it's facing acute staff shortages, underfunding and rapid privatization, which means that the crown jewel of Britain's public healthcare provision may soon be no more. Saipur is Press TV, London.